talk today about developing and negotiating research site clinical study budgets and contracts, as the title leads us to believe here. So we had a question for you. I think I already know the answer to this, but is your job function primarily at a site? So raise that hand. A sponsor CRO, give me a green check, please, an IRB, a red X, or if other, give us that smiley face. Okay, and I know some of you, what you do. All right, great. Thank you so much. So we are sponsors. So we're going to talk about working with sites for negotiating these budgets and contracts. We'll talk about some of the concerns that we have and that we see, what our requirements are. Certainly look to you as well for information about some of the things that you might be coming across as an issue. Our industry is constantly evolving and things pop up in terms of what people expect, what maybe other sponsors have provided to them. I'm sure you bump into that as well. So according to a CenterWatch survey, budgeting and contracting remains a top cause of study delay. So of the 950 sites that they reviewed, the 950, 49% said that contract and budget negotiation and approval were a key factor in delaying the study more than anything else, including participant recruitment. So one of the concerns that we see, obviously, and one of the reasons that the industry shifted years ago was pulling out of academic medical centers, going to more freestanding research clinics, working with CROs and others because of the concerns in lag time and delays when going through an academic medical center or institution. But we know full well, and it's interesting to me, that we are moving back into those spaces because that's where the research is happening, and that's where we're seeing those participants, potential participants. So when we think about the cost of trial delays, what does it mean for you? So how many of you have had a trial that has been delayed because of negotiation for budgets and contracts? Can you give me a green check if so, please? Okay, so most of us. So when we look at that, it is certainly frustrating. As an auditor, the concern that we see is that oftentimes the contracts are the focus, but there are other issues that really should be addressed as well and be given just as much focus. And we'll talk about those because we have to think about feasibility. The site will certainly have their expectations for feasibility, but when we are selecting sites and working with them, sometimes that delay should be a sign for you. And we'll talk about those concerns too. So startup and enrollment challenges are considerable factors when it comes to costs that are expended by sponsors in conducting research. So the concern that we see in terms of length of delays can be spelled out in these numbers coming from accelerating clinical trials, budgets, patient recruitment, and productivity. This information tells us that we can take up to 42% longer than expected in a phase 1 study for those startup and enrollment challenges. Now, this combines those two, whereas opposed to the CenterWatch was just looking at the budgets and the contracts. But longer in a phase 1, longer in a phase 2, shorter than a phase 1. Maybe by phase 3, we kind of get the hang of it. Maybe folks that are doing phase 3 studies are have a little more experience. Maybe they are part of an institution or an organization that has the infrastructure to support these things. But each day that a clinical trial extends over schedule, you can lose a significant amount of money. And I know some of you are working in drugs and biologics and some of you are in medical devices, but to suffice it to say, even if it's not these exact numbers, it impacts you. It impacts your bottom line, not only from a financial standpoint, but at the time, as well as future earnings, because we're looking at patents. We're looking at that clock is ticking. We also worry about it from a personnel standpoint. Maybe we are working with a CRO and we've identified our team. I do a lot of pre-qualification audits, and I see this quite frequently, where we go out and we select vendors. We want to work with them, but because of delays at the site level, by the time those sites get up and running, we may not have access to those individuals any longer unless we've paid a retainer. So you're paying to sideline some folks. So Those delays are going to be critical on many fronts. It also has a personal cost as well. It's very frustrating. And particularly for those of you that have been working with this product, trying to bring it to fruition, right? It's really your baby. You may have carried it out of the lab and into these earlier phase studies. Trying to see it get approved, it can be really frustrating and impactful in terms of those delays that appear to be easy to resolve. And we're going to talk about that in terms of negotiation. We each come with our expectations. Each party brings expectations and desires, and those don't always align. So, estimated per patient cost average from July of 2011, that same article, looking at it in terms of what it costs per patient. And we've seen a significant increase over the last several years in what it costs us to be engaged in these types of studies.